You're listening to Through Help and Back. Through Help and Back is a podcast focused on mental health, addiction, treatment, recovery, and all things related to personal improvement and wellness. Don't worry, we're not here to talk about problems without solutions, and we're definitely not here to talk about struggles without success. So come with your problems, leave with our solutions. The fact that recovery is possible is really kind of the theme of today's podcast. I have an amazing guest on here that is going to come and share a personal experience that not only he had, but he continues to have. Corbin Coulter is a young man who suffered a traumatic brain injury. He's got an amazing story about life before, life after, and what it's like to go through that. He's an awesome guy, really upbeat, really positive, and we're just really proud and happy to have him. So, Corbin, my man, it's really nice to see you. Thank you so much for coming by.
You're very welcome, Jason. Thanks for having me, man.
Absolutely. So tell me a little bit about where you are. Where are you in the world, and like where do you live? Where are you from?
I'm currently residing in Kelowna, British Columbia, Canada. I was born in Edmonton, Alberta, but I've been living here for a couple of decades, man. So it's pretty much home to me.
What is life like where you're from? I mean, we think Canada, we think snow, we think moose, we think universal health care. That's kind of all we know about Canada down here. So what's life like in Canada?
You are pretty correct with that. You get all seasons, so you do get a lot of snow, but you also get beautiful summers, and the nature around here is just amazing. And yeah, I don't know what else to say about that.
Well, growing up, were you a big outdoors guy? I mean, is that what it's like for kids there? Did you spend a lot of time out in nature? Were you kind of go?
No, I wasn't a big outdoors guy. I had friends, and we would always hang out outside. The weather it's beautiful, like besides the winter where there is quite a bit of snow.
Typical childhood? I mean, anything noteworthy? Like, was your family together? Like, did you guys move around a lot, or what was childhood like for you?
My dad and my mom got separated when I was young. I've had a stepdad for most of my life, for like 20 years. He's been great. I rarely see my actual dad. I still try to keep in touch, but my childhood was great. I don't got anything bad to say about it.
Yeah, that's awesome. Yeah. It's funny on podcasts like this, you know, there's usually like a terrible story, you know, something out of childhood. There's trauma, there's abuse, there's a lot of things that people deal with, but you were lucky. You didn't have much of that when you were young. One thing I want for our listeners to kind of notice and recognize right off the bat is our guy Corbin here has discovered the fountain of youth because he is much older than he looks. And so obviously we're going to talk about, your injury and events that happened after that. But there was an adult life for you before your injury, right? So you were fully grown up, working, living your life. What was life like, early adulthood, before this happened?
It was mainly focused on my job at a lumber mill. I spent a lot of time working there. It was great for the time that it was. I'm happy to not be there now.
When you weren't working, what did you do for fun? Were you, did you go out a lot? Were you a workout guy? Were you like, what was fun? What was your hobby?
Yeah, I went to the gym lots. I mean, it's been a daily thing for me for, I don't know, like close to 15 years now.
Awesome.
I was in mixed martial arts doing Muay Thai for a while. I've just always been a really active guy. I think when I did sustain my injury, that was one of the positives that really helped propel me in my recovery. No sports or anything really. Like I played football, but that was years ago.
Before your injury, you kind of had this baseline of physical health. You had strength, you were physically healthy and active, but you also had those habits in place. You were used to going to the gym every day. And then that turned out to be a real big asset, a real big help for you. Is that what I'm hearing?
Yeah, that's correct. I mean, I didn't have all the habits I have now, that's for sure. But it was the gym has always been a habit of mine.
What were you doing in the gym? Were you a strength guy? Were you like cardio? Were you CrossFit kind of thing? What were you into?
No, I was a strength guy, like always trying to push as heavy as I can. I guess ego lifting, like, I don't know, man.
Doing those lower back curls where you're just like swinging that weight, you know what I mean?
Yeah.
Yeah, we've been there. We've been there for sure. So let's get into it, man. Obviously, a key part of your life and a big transition in your life was your accident. So do you want to kind of take us through what happened there?
I was at a bar and it was time to leave the bar. It was my idea to call a taxi, and then they said they would be 20 minutes. I said, oh, sweet, that's enough time to go climb a tree. Sure enough, I wake up a month later, had to relearn to walk, how to talk, basically everything you need to know to survive. I couldn't breathe by myself. I had a tube in my throat. I couldn't eat by myself. I had a tube in my stomach. Yeah, so I was in the hospital for 4 months. I graduated to a rehabilitation home for another 4 months. And then I was back living on my own 8 months after my injury.
All right, so you're at a bar, some drinks. I assume, were you intoxicated? Like, did they have like a blood alcohol on you or something like that? Like, how intoxicated were you?
Well, I was actually on my stepfather's boat all day before the accident. And by the time I was off the boat, like I don't remember anything from getting off the boat. I didn't lose any memory of like my past or anything like that. But I was very intoxicated.
And I love it, man. You have to laugh a little bit. Like the cab's going to be 20 minutes. Great. That's plenty of time to climb a tree. So like, of course.
Yeah, I know.
Of course, right? Of course. I hate when the cabs come and you don't have time to climb a tree first. It's like the worst.
I know,
it ruins the whole night. So you go out, you start climbing this tree, and then not to get too technical when I'm not a doctor, but like, so what exactly happened? Do you know how high you were that you fell from? What was the specific injury?
Dude, I have no idea, but my whole left side has been affected. So that means I smashed the right to my brain. So I believe I came down the tree, which was pretty high up, and I smashed a branch on the right side because I ended up landing on my left side. I suffered some broken ribs, bruised lung, a broken pinky, then, of course, a severe traumatic brain injury.
So paramedics arrive. They scoop you up. They say, was there surgery right away? You said you spent 4 months in the hospital? Like, what did they have? Do you know what they had to do to save you or stabilize you?
I don't know if you can really tell, but
a little bit.
This pinky was snapped in half, like completely, man. But I think the main thing was all the bleeding from my brain. So I don't know exactly all they had to do, but
when was because you kind of talk about you remember everything until you get off the boat and then you sort of wake up. When did the memories start again? Like, where were you when you kind of came back to consciousness and you can actually start remembering what was happening? Was it while you were still in the hospital?
I remember a time from when I was supposedly still in my coma, but my ex-girlfriend came and she was talking to me, and I was told I was still in a coma, but I remembered it. I mean, I couldn't talk or anything.
So they're breathing for you. They're doing surgery. You get out, and you mentioned that you had to kind of relearn all basic functions. So what is that like? We read about that in the paper or on news stories sometimes, and they say that, had to learn to walk again. What is that like to be kind of a healthy, strong guy, and then the next minute you're relearning how to walk? Like, how was that process for you?
Dude, it was crazy, but I've always looked on the bright side of things. I always considered it was like a video game. I would have to level up. I don't know why it might sound crazy, but the fact of now my life is like a video game where I can just always little by little, I can get better. I mean, I might never be able to get 100%, but little by little, I can do that.
I think that's an amazing outlook because honestly, I think part of the reason we like video games so much, and I still play video games to relax, is the fact that I think life is so much like that. It's exactly that. You're acquiring skills, you're moving through these challenges, and that level up mentality. Is that something you've always had internally, or did somebody teach that to you?
No, I guess I've always kind of had it internally.
2 questions. What's the worst part about recovering from a brain injury? And then the second question is, what's the best part about recovering from a brain injury?
It's going to be hard to answer because I've never really thought of that. The worst is probably just the daily struggles, the mental health struggles and challenges that come with the brain injury.
The worst part sounds like just the daily struggle, right? Like you have a challenge every day that you're going to have to deal with. Have there been any good things that have come out of this? Have there been any positives?
That's the thing. The worst is also the best. It's all my challenges and struggles. They're all positive to me, man. Like,
I don't say you feel lucky, but do you feel blessed? Do you feel gratitude? Do you feel grateful for the position you're in? Because I think sometimes
I don't know if you can see that, but it says blessed there.
Blessed. Oh, I see it now. Yeah, yeah.
Yeah, I feel completely blessed, mainly for being alive because of the shit that I've been through.
How has this impacted your family and the people that love you? Are they supportive of you, or have they rallied around you, or has it caused struggle for them as well?
I think it has caused them some pain. It's really tough with them. Like, they'll never see it as a positive. They'll never see why I am very grateful for all of it. They'll always look at it as a bad thing, like as what they had to go through. I've lost a lot of friends, not because of it. Like, it was more because there's such a change in me. The person I used to be is nowhere near the person I am now. And I am very grateful for that. Like, and it was definitely all my choice.
In a way, you're better for it, that maybe you're a better man today than you were before, even if you have physical challenges.
I believe I am. And like the thoughts that I used to have before, I would never have those thoughts now.
Can you give me an example? Like, what's a thought that you used to have that you don't have anymore?
A judgmental thought, like judge people. I would laugh at somebody, like I would internally judge them. And now internally, I think like I just don't judge at all. So
we hear about this sometimes. Thank you for sharing the details of this. It's amazing to hear. I mean, it's a struggle, but to think about the idea of a traumatic brain injury and to see you sitting here strong, capable, and talking about how it's given you things and how it can be a positive is amazing to start with. But I think a lot of times in those near-death experiences or super traumatic experiences, all that noise that's in our brains kind of goes away and you just focus on what's most important, right? I'm alive. I'm still strong. Like, I'm not judging other people. I'm just focusing on my experience. You know, you're really cut down to the basics where I'm only going to put my energy into the things that really matter at this point, you know, and some of that judgment and silly shit that people get into, petty fights, silly arguments. It's sort of like, what's the point? Like, we're here, we're alive. Let's be grateful for that moment, you know. You talked about some of your new habits. So take us through kind of a typical day. Somebody with a brain injury, what do you have to do to level up? What do you have to do to maintain on a day-to-day basis?
First of all me and I've started very small, very slowly with everything that I do. It's just what I do now. And right now I meditate in the morning first thing. I do breath work. I make sure to drink a lot of water. I go to the gym. I'm really focused on my nutrition, and I'm pescatarian. So I would be vegetarian, but because of the health benefits from the fish, I like to indulge myself with the omega-3 fatty acids. And it's hard to tell you exactly all I do it feels like I just do so much.
Yeah. Yeah. But it sounds like you're living intentionally now, right? You're making choices on purpose to contribute to your health. Whereas before, maybe you weren't thinking that way.
I don't think I was really thinking much, man. I was probably thinking how to get laid and
just more in the moment stuff. Yeah. You made a comment when we first started talking about how important mental health has become to you now. So what are the things that you do to build up and level up in your mental health?
my meditation, my breath work, my exercise, which is very good for the brain, my nutrition, also very good for the brain, very good for everything. Go for a walk out in nature. I love this simple life, man.
Are you happy? Are you happy with it?
I am happy. Yeah.
Because I'm a parent myself, and I'm sitting here thinking about your parents, and if I had a child that went through that, that would be my fear, right? So physically, are they going to be okay? And it looks like physically, you've made great progress. But then you would start thinking about those other things, like, will they be in relationships? Will they be able to be happy? Will they live a full and rewarding life? And it sounds like, to a large degree, those things are all still happening for you.
Yeah. And I'm still super young, and I have a lot of life to live, and I'm looking forward to the life that I have to live, and especially having a second chance, man. Yeah, I'm happy.
I'm sitting here looking at Ian. Why does it feel like the prescription for living with a brain injury is just a good idea for everybody, right? Like, get up, live intentionally, meditate, get your water, get your exercise, connect with nature, live in gratitude, live with appreciation. Like, I'm almost sitting here kicking myself like I should just be doing this day in and day out. You don't have to fall out of a tree to adopt any of these habits.
Well, no, that's just it, man. I recommend it. Like, they're very good habits. And I think suffering is the greatest teacher. I'm trying to teach people about all this good stuff that I've learned through my suffering so that they don't have to experience the suffering. Just the beginning, man.
Yeah, definitely. What do you tell me about some of that? You said you want people to learn that and to teach that. Do you put your message out? Like, what are you doing to offer that or to teach other people that?
There is a community I got associated with, Brain Trust. It's a community focused on support to people with brain injuries. And we've actually got a conference coming up, West Coast Conference, and I'm going to be the speaker there. So there should be a lot of doctors and a lot of people out in the audience that would like to hear what I have to say. And I'm just trying to use what's happened to me to get my message out there. It's just my hope, man.
No, you're doing it. You're not hoping it. You're doing it. It's incredible. There's a lot of this that you've added to your life as a result of this, these new habits, this message, this new mindset. Is there anything you lost because of this? I mean, whether it be functioning, abilities, relationships. I mean, have there been things that you've lost along the way as well?
My whole left side is not 100%. It's probably 75 at most. The control I have over my left leg is not very good, but I can still live on my own. I can still do everything that needs to be done to live. I could still go to the gym. I could still walk. I can still talk. I mean, I'm just grateful. There's so much things that was said that possibly be taken away from me with the walking, with the talking, and the driving. And it never crossed my mind that those were going to be ever not doable again.
Well, I think not just for you, but for the world at large, thank God that we didn't lose that and didn't lose your message and didn't lose your example. It's inspiring for sure. And I'm just struck by, thinking about how, and you weren't conscious, but how you must have felt or how your family must have felt like right after the accident, right? You're laying there broken. They've identified a brain injury. There's a bleed. And you would have to think in terms of my life is over, right? Like, this is terrible. This is a tragedy. I'm going to lose everything. And to see you sit here today, a couple years later, and I ask you, what did you lose? And you're like, not really, nothing. Nothing. I've gained so much, and I'm so grateful that I don't really focus on the losses. I don't know. I'm just struck, right? That was a surprising answer for me. I would expect somebody to say, like, no, there was a heavy cost, but you seem like you're in such a good place with it that you're not feeling that loss.
when I woke up from my coma, I thought I would be in there for a few weeks. And I was thinking, it was going to take a few weeks to learn how to walk again. And then I'd be walking right into my old job at the lumber mill. So ever since I opened my eyes, man, it's just been positive thinking, man. I've just had a lot of belief, man. Things are going to be okay.
Yeah, it's such a significant thing you said there, though. Ever since I opened my eyes, I feel like we all have times we need to open our eyes and see what's really going on, and not get caught up in the noise, What are you working again? Like, it's just getting back into the functionality. You said you didn't go back to your old job. Are you working now?
Yeah, I'm working part-time for around 4 years now. I work with a company Yard by Yard, and they're associated with the Mental Health Services Society. Yeah, so I work part-time landscaping, and I love it, man. I consider it to be like a dream job for me. Like, it's perfect. I'm working outside, working outdoors. I make sure I never push myself too much. I still got to be mindful of my tiredness, I guess.
Do you fatigue? You fatigue pretty easy now? Is that, you said be mindful of my tiredness? Is that one of the long-term effects?
I wouldn't say I fatigue easy, especially if it's something that I enjoy doing. Like, I won't fatigue easy, but with my lifestyle, I like to, like, I'm a morning person. I love to wake up by 4 a.m.
Yikes.
Yeah, and so I'm pretty tired by late afternoon.
You mentioned early on, like, your life before you were kind of going out, you're chasing it, things like that, being in and out of relationships. Have you had relationships since your injury? How has it affected your relationships? Like, are you dating? Are you looking to date people? Like, how has that part of your life changed?
No, I'm single. I've been single throughout my whole injury, and I am open to having a relationship, but I want to find somebody who's really into health like me. I don't want to just jump into something like, because I personally, I love being alone. I'm not lonely, but I do love being alone. So I think there's a big difference between being lonely and being alone.
Big time.
Yeah. So I'm still open. Like, it will happen. I want to grow myself first. I want to keep loving myself. And when I keep getting my story out there, keep doing everything that I'm doing, it will happen in the right time. So I believe so much in it's just my time. This is my season, I guess. Like, it's what Lewis Howes says.
No, and you're stumbling into some really important points. I mean, I do a lot of therapy with folks, and that's something I've really stressed is worry about being somebody, then worry about being with somebody, right? And it seems like that pressure has flipped for you. You're focused on self. You're alone but not lonely, which is a key point. Just because you're alone, you don't have to feel lonely. And you're focusing on who you want to be. And then you will naturally attract the person who fits best with that version of yourself. I think so many people do the opposite thing. They run out and they cycle through partners and they get in and out of relationships trying to find something that maybe makes them feel better in the short term, but that doesn't necessarily serve your long-term happiness.
I was forced into this situation. I mean, before this all happened, I was that guy who didn't really want to be alone. I always wanted a girlfriend. And yeah, I've been forced in this situation of being alone and really having time to look inward. And like, a lot of magic has happened since this happened. So.
Well, you're in good shape, man. You're still handsome, so you're going to be fine, right? Like, I mean, that's just, you're still working out. You're living a healthy life. Good looking dude. He's going to be fine. So it's good that way.
Thank you.
I want to expand the conversation beyond just this idea of brain injury and just talk about facing challenges. You didn't choose it, right? But you woke up to some incredible challenges, right? One day you're cruising along, the next day, okay, let's see what you're really made of. One of my favorite theorists or therapists was Milton Erickson, for example, and he became disabled, fully disabled. And so he was left in his room, kind of disabled. And eventually to cut to the end of the story, eventually he would walk again and become fully functional again. And people talked to him about how he did that. And he started by saying, well, I didn't have any dreams of walking again. I just wanted to move my little finger. And all day, every day, I would stare at my pinky finger and I would think about, I need to move this finger. And one day, a twitch, a little tiny bit of movement. Well, now I want to move the next finger too, and so on and so forth till now I can move my whole hand, I can move my arm, I can move my legs. And so in your answer, you talked about keeping things small and focusing on the next step and the process and the next goal. And I think that's a good way to keep your sanity for sure, because when you're not even breathing for yourself, how can you imagine the life that you're living now? It also keeps you focused on just the next step, which makes it seem more achievable. What kind of supports have you had in place? Do you go to physical therapy? Do you see a therapist? Do you get counseling? Like, what kind of supports have you put around yourself?
I do therapy. It's actually pretty new to me, but physical therapy, I was doing outpatient rehab at the hospital for a couple months, maybe after, like this was like years ago. I haven't done any physical therapy since. I go to gym almost every day, and I'm basically my own therapist, man. But my physical therapist, I go to therapy with my community with Brain Trust. Yeah, they give me a lot of support
on the mental health or the mental therapy side. Which it's amazing. You're your own physical therapist. I mean, if you're working out every day and doing landscaping work, like you're getting your exercise, there's no doubt.
Oh yeah.
On the mental health side, is there anything that they've given you or taught you that has been really helpful, or is it mostly just the fact that you have support and people on your side?
That is good, having all of the support and all that, but you need to be your biggest supporter. You need to implement these daily habits. And just recently, doing breath work has probably surpassed my love for meditation, because of the benefits I've been feeling from that. And I love having the support when I need it, but I get a lot of benefit from supporting myself, believing in myself, and just I don't know, just try to live my best life, man.
Well, and you're owning it. I mean, what I'm hearing is instead of sitting around and waiting for somebody else to do it for you, or being overly dependent on helpers, which helpers are essential. I mean, certainly, but you take it home and you own it and you go live it. You don't wait
Yep.
for somebody else to come do it for you. Like, all right, I'm going to be my own physical therapist. I'm going to be my own support. I'm going to invest in myself. I'm going to do the next thing. So it sounds like you're very action oriented and just owning your situation, because it truly is an inspiration, man. Because some people could have the exact same injury you've had and they just stay in bed forever. Right? It's like, my life is over. I'm only focused on what I lost, what I don't get, and they don't progress. It doesn't sound like you're willing to accept that fate.
Yeah, no, the victim mindset is something I've never wanted to accept. The growth mindset is what I have fully embraced. I'm just in love with growing as a person, learning. I just love everything that is good for the health, good for the brain.
Are there things that are specifically good for your brain that you've been taught that you wished that you knew before? Like you mentioned eating fish. Like, are there things that people can do to take care of their brains before they have to fall out of a tree? Like, what can I do right now today to have a healthier brain?
The big three that I say is make sure your nutrition is good, and that's eating whole foods. It's called the Mind Diet. It's Mediterranean. It's a lot of vegetables, a lot of fruits, a lot of nuts, seeds, fish, mainly that. Exercise, you should know that it's not just for your body. Like there's so much science and whatnot, how exercise, cardiovascular exercise is good for your brain. If your nutrition and your exercise are good, your sleep will greatly benefit. And sleep is also one of those things where it's very important for your health. Your diet, your nutrition, your exercise, your sleep. I would say just work on those three things, and you will see a lot of benefits. And then after you get those three things dialed in, you can work on other habits like sit down and meditate for a couple minutes, something that I couldn't do at the start. But eventually now I could sit for a long period of time. There's just so many things that pick up a book, read a book, learn some things. I've learned a lot through all the books that I've read. I'm learning new languages. I have a couple of friends that are helping me with Spanish and Chinese. So learning that way, new languages, I don't know, man.
Yeah, no, you do know, because your answers are phenomenal. I mean, it just, I'm like, what is, like, why is this dude living a better life than like 90% of everybody around us? You know what I mean? Like, you're talking about the diet, and I see the lines around the block to McDonald's. You talk about exercise, and the gym is empty. You talk about reading a book, and so many kids nowadays are like, what's a book? They're not reading books, man. They're reading Twitter. It's like, so I don't know. I think it's amazing.
I'll tell you one thing why I really like reading now, because after my injury, I did enjoy reading before my injury, but I had severe double vision when I woke up from my coma. I couldn't read it at all. It was gone. Like, that is something I would have lost if I believed that was lost. I've done vision therapy to help with my eyesight. Now I see perfect, and this whole bookshelf is almost full because I've read almost 100 books since my injury, and now I love it, man. Like, reading it's one of those things that was pretty much taken away from me, but I didn't accept that.
Something I would have lost if I had believed it was lost is such an astounding thing to say. And hopefully you'll get serious and write yourself a book one day. I mean, I can just see it. Like, live like you have a brain injury, right? I mean, that's the book, And there you go, man. There's a free one. You can have it. It's your story.
A couple of years ago, I was actually starting to write about my story and all of that, but I've just gotten like, I was writing it on my computer, my laptop, and it's hard staring at a screen for a long time. Like, I don't like to do much technology. Like,
yeah, me either.
But yeah, that is in the plan. But like, now that I got my speaking gigs coming up, I really want to capitalize on that and see where I can go with that. And I've got such an open mind. So there's a lot for me to do.
There's a lot for you to still do. Yeah, for sure. All right, man. Listen, we're getting close on time, but I want to give you an opportunity here. Is there any kind of final message about your situation, or any final encouragement? If somebody's listening to this and they're, it may not even have to be brain injury, but they're dealing with challenges, or things are feeling too big, or they're feeling stuck, and want to make these changes, want to level up, like you were talking about. Any advice or encouragement you would have for those folks?
Go inward, ask yourself, what difficulties or what challenges are you coming face to face with, and see what's the smallest things to benefit yourself
So I forget who it was, but it was this idea of what's the smallest thing that you could do, that you would do, that would have the biggest impact on your life, right? And so that stay small, start small, stay small mentality can have enormous benefits, right? That's the atomic habits, 1% better every day. At the end of the year, it all stacks up. It's like that snowball rolling down the hill. So I love that mentality about starting small and focusing on the little things.
Have you read that book?
I have.
James Clear, right?
Yep, that's right.
Yeah, that was a good book, man.
Yeah. Yeah. And I think I see, I'm not surprised that you've read it, because I think I can see a lot of the influence in your daily plan. You've got a lot of those atomic habits, if you want to call them that, those small things that have outsized benefit. Yeah, sure. There it is.
Book recommendations. Dr. Daniel Amen.
Mm-hmm.
This book has really changed my life.
That book you just held up, though, the Daniel Amen's book, where he talks about there is no mental health, that everything is brain health.
Yeah, that's basically what I live my life by right now. Like as long as you look after your brain health,
Yep.
I think that will greatly reduce the mental health problems. And
I agree. And there's a lot of that when we start in therapy, I think responsible therapy starts with an assessment of biological needs, because there could be chemical imbalances, there could be deficits, there could be even habits. You talked about sleep. There's a lot of people that can come in and they can appear manic, or they can appear depressed, or they can have outside anxiety. That was part of my story, to be transparent, was I dealt with anxiety for a long time, and a lot of it traced back to my sleep hygiene. For a big part of my life, I slept terribly. I would stay up till I passed out. I would wake up and I would chug energy drinks to get through the day. And then, of course, I would have to take sleeping pills to knock myself out at night. And I got into this vicious cycle where I was getting basically no good sleep. I was getting plenty of sleep, but I was getting no good sleep. And once I solved that problem, I was a much happier dude. What do you know? So
yeah,
it's a big part of it.
Yeah, brain health, man, it's very powerful.
Corbin, what's next? You talk about leveling up. What's the next level for you? What's your next goal? What's the next thing that you're working on, or the next step in your progress?
I've got speaking gigs coming up now. Facing my fear of public speaking is going to be huge for me. Besides that, I don't know where the public speaking thing can go. Like, I don't know what's next. I live in the unknown, but all I know is it's going to be good.
All right, we're done, man. You crushed it right there. That's the home run, walk away, flip the bat line right there, man. I don't know what's next, but I know it's going to be good. Sometimes, they say seeing is believing. I think you're a living example of believing is seeing, right? You believe it, and then it's going to come true, and it's not going to come true until you believe it possible for yourself. So, listen, Corbin, I appreciate your time so much. Congratulations on your progress, honestly.
Thank you.
When we first started talking and thought about this episode, my thoughts about how this episode might go was going to be, dealing with depression, dealing with setbacks, a lot of struggle. I didn't know that this was going to be such an inspirational, uplifting episode. But I think your story is going to have a huge impact on the world, man. And I encourage you to keep sharing it. It's an amazing story of resiliency and progress and belief, and just congratulations.
Oh, thank you a lot, Jason. Thanks a lot.
How do people find you? Do you do socials? Do you do Instagram? How can people get access to you and your message?
I only do Instagram. That's the only social media I really use, basically because I'm very mindful of the content that I'm following and whatnot. Yeah, so at Corbin_TBI_recovery. That is my Instagram, and that's the only place really you can reach out and get a hold of me.
Okay. And Ian will post all that in the show notes, and we'll make sure everybody has access to your site, and who knows where it'll go, right? We don't know what's next for your social media, man. You might be one of those guys with 10 different accounts and 1 million followers. Cause like I said, this is an incredible story. I think people are going to really want to hear it. So,
well, like I said, I don't know, but it's going to be good, man.
Yeah, that's awesome. Corbin, I'm going to cut you loose. Thank you so much, man. I appreciate your time. I really thank you so much for stopping by. As always, thank you, Ian, for producing the show and making us look good. I screwed up a lot this episode, so Ian's going to have to edit overtime and make this work, so it's amazing. And as always, I want to thank you, however you're consuming this content, whether you're in your car, at home, at the gym, whether this is YouTube or one of our social media platforms. There is no greater resource than your time, and so I thank you for donating some of your time to us and getting this message from Corbin. Always give a shout out to our sponsor, New Behavioral Health. If you are struggling in any way as part of your recovery plan from a serious injury like Corbin's dealing with, or even if you just have a day-to-day sense that life could be a little bit better, in Ohio and New Hampshire, New Behavioral Health has psychiatrists, psychologists, therapists, case managers, nurses, pretty much whatever you need to put an integrated plan together to support your progress and your well-being. I'm just struck. Corbin has changed my life with this message already. I was going to skip the gym today. There's no way in hell I'm skipping it now.
No, it better not.
No way, man. I'm getting off here and we're going straight there. Stay in a place of gratitude. We don't know what's next, but we know it's going to be good. So thank you so much. And until that good things happen, take care of yourself and take care of each other. Thanks so much. Hey guys, although Through Help and Back is an excellent podcast with a lot of great ideas, I do want to let you know that in no way is Through Help and Back expected to be perceived as or relied upon in any way as specific medical advice or mental health advice for you personally. The information provided through Help and Back on our website or our podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment that can be provided by your own providers. Do not use our content in lieu of professional advice given by qualified medical professionals, and do not disregard professional medical advice or delay seeking professional advice because of the information you have read on our website, heard on our podcast, or otherwise received from us. Although we love discussing issues related to healthcare, mental health, and addiction, we are not providing direct healthcare, mental health care, medical, or nutrition therapy services. We're not attempting to diagnose, treat, prevent, or cure in any manner whatsoever any physical or psychological ailment, any mental or emotional issue, disease, or condition. We are not giving you specific medical, psychological, or religious advice whatsoever. Please take care of yourself and take care of others as you always seek the advice of your own medical providers and your own mental health providers regarding any questions or concerns you have about your specific health, or before implementing any recommendations or suggestions from us. These are ideas that have worked for other people. We think it's important to share them. We do not guarantee that they will work for you specifically. Do not stop taking any medications without speaking to your physician, nurse practitioner, physician assistant, mental health provider, or any other healthcare or medical professional. And if you have or suspect that you have a medical or mental health issue, contact your own healthcare provider promptly. Also, one last thing, if you know or suspect that you are currently experiencing a crisis, it is absolutely imperative that you seek the advice of your doctor or other emergency healthcare services prior to ever thinking about using our content. We love the conversations. We're glad you're stopping by. We hope you take a lot from the content. But again, for your specific individual medical situation, please always seek quality personal care from your own providers. Do not let this information or this advice stand on its own. Thanks so much for listening.